So today I'm going to try and answer a $1 trillion question, which is how are we going to get out of this pandemic? And to put, because I have such great ideas, and it doesn't seem like you need a degree in science anymore to comment on these issues. So here's a nun's perspective. But to answer this question, I want to take you back to the 19th century first and introduce you to a German physician named Rudolf Virchow, who lived from 1821 to 1902. And he is known as the father of modern pathology, which is the study of the causes of diseases. And he's also known as the founder of social medicine. And incidentally, he was also an anthropologist, prehistorian, biologist, writer, editor, and politician, all in his, that's like the side stuff, right? So here's a little introduction to this Dr. Rudolf Virchow from the book Mountains Beyond Mountains by the journalist Tracy Kidder, which is about an infectious diseases doctor, Dr. Paul Farmer. So, Rudolf Virchow was one of his inspirations. So it says in the book, when he was only 26, the German government sent Virchow to Upper Silesia to report on an epidemic of what was then termed famine fever, now called relapsing fever. Virchow found a region impoverished by absentee landlordism, where the people, mainly Polish, lived principally on potatoes and vodka, and suffered from endemic malaria and dysentery. In his report to the German government, he wrote that abysmal social conditions, which the government had fostered and done nothing to relieve, had caused the epidemic. I'm just going to repeat that sentence. He wrote that the abysmal social conditions which the government had fostered and done nothing to relieve had caused the epidemic. So this was 40 years before medical science identified biological sources of relapsing fever. Its vector is the louse, but subsequent discoveries would show that Virchow was right. Epidemics of the illness usually occur after social upheavals in the ensuing overcrowding, poor hygiene, and malnutrition. So in his report, Virchow expressed a fundamental law of epidemiology. He wrote that if disease is an expression of individual life under unfavorable conditions, then epidemics must be indicative of mass disturbances of mass life. His prescription for curing Upper Silesia was full and unlimited democracy. This meant, among other things, establishing Polish as the official language, taxing the rich instead of the poor, getting the church out of the business of government, building roads, reopening orphanages, investing in agriculture. The government fired him. So Virchow would write, my politics were those of prophylaxis, getting at the root of a problem. My opponents preferred those of palliation. So dealing with the symptoms, not curing what's happening at the root. And so Rudolf Virchow had a knack for aphorism. He said, medicine is a social science, and politics is nothing but medicine on a large scale. It is the curse of humanity that it learns to tolerate even the most horrible situations by habituation. Medical education does not exist to provide students with a way of making a living, but to ensure the health of the community. Physicians are natural attorneys of the poor, and the social problems should largely be solved by them. So this last quote was Dr. Paul Farmer's favorite. So that's a bit about the father of social medicine, and I think he has his finger on the button still now, more than a century later. So how are we going to get out of this pandemic? Here's my prescription. Start with the poor. Start with the most vulnerable communities. Why? I don't think it takes an MD to figure this one out. That while we shelter in place, these are communities that have no shelter. Even if they do have a place to shelter, it's likely to be very overcrowded, whether it's a dormitory for homeless people, for migrant workers, or you have multi-generational households packed into a single small building to save rent, right? These are communities that have no access to running water, so forget about washing your hands regularly. These are communities that already lack food security, have underlying chronic health conditions. If they have been working in low-paying jobs, they're very likely to have lost them, or they work in jobs that expose them to high risk. Right? They have to be on the front lines. They don't have savings to tide them over. This is a community that cannot afford to take sick leave, that doesn't have health insurance, and their children will face the biggest losses in education. So what we see in this pandemic is that groups that are already socially, culturally, and economically excluded, where communication is difficult because they don't speak the main language possibly, or there's very low trust of government institutions, these are the groups where the pandemic is spreading the most quickly. And so these are also communities where the solution will be the most complex and requires a lot of partnership. And I believe that until we control the epidemic in these areas where the incidence is higher than in the rest of the population, there will be no end in sight for this pandemic. So let me just talk about a country that I know very well, which is Singapore, and what's happening. I think it's all over the news if people have seen it, that 92% of the COVID-19 cases in Singapore are among migrant construction workers who live in overcrowded dormitories. Yeah, so and the incidence is significantly higher in that population than, of course, in the rest of the community. Yeah, so they often live in overcrowded dormitories that lack proper sanitation. The government and the population has been aware of this for a long time, since when I worked in the labor department way back. But there's been a lot of, it's difficult to, how do I even talk about it? It's a very complex industry that involves workers mostly coming from India and Bangladesh, but other countries too. They often sell their houses, they sell land, they sell their whole businesses, and to pay agents up front, up to something like $7,000 to get a job placement overseas, because they've seen their friends do this. It looks like a really good way to make money, right? So you wind up getting placed in countries like Abu Dhabi, Saudi Arabia, Singapore, all over the world, working in the construction industry. Yeah, and then each country will have its own set of regulations. But you look at your friend, it looks like they're doing very well, right? Suddenly they came back with a lot of money and built a big house, and you're like, hey, I'm young, I'm healthy, why not? I want to see the world, let's give this a try. So in Singapore, at least, the housing regulations for the migrant worker dormitories have been lacking for a long time. A big piece of this, I think, is because no one wants to pass on the cost to businesses, right? Because once you regulate that way, people have to pay for the dormitories to have better conditions, the business has to incur higher costs, and then that all gets passed on to the consumer. So and this is a group of people who are temporary workers. They're there for anything from 2 years to at most 10. I think 10 is long. So, they don't have a voice, and they're going to go back anyway. So you just let things be until a pandemic hits. And all these people who are it says in the press, 20 people to a dorm with one bathroom. I think, honestly, I've seen, at least one time I went to visit, it was like 60 people to a room. They're often overcrowded. So you can imagine these are petri dishes for disease. Very thankfully, the government has really stepped in and seen the severity of the situation. Why the numbers are so high is because they've actually sent in the army, and I believe the police too, to actively test the migrant worker communities to try and catch every single case. And then from there, you can actually isolate people who are sick, quarantine those who have been exposed, and all the healthy workers get rehoused somewhere else. So that's really helping to, it has not resulted in a great number of deaths or the healthcare system being overwhelmed. I believe the government also funded employers to pay the workers' salaries while they were quarantined, and they were delivering meals to the workers 3 times a day as well. So, it's taken a tremendous effort on the government's part. What moves me the most is to see that there's been a lot of community dialogue starting around rehousing migrant workers, especially in close proximity to citizens. Yeah, I saw that there was, and it's driven by the young people. That's what gives me a lot of joy and hope. I watched a Zoom panel where they had young people talking about this issue. They invited a doctor, and they invited 2 migrant workers to share their experience of COVID-19, what it's like for them in the dorms, what it's like for them to be rehoused. It was just so nice to see that the workers are getting a voice and being treated as humans, not just, a number or a stranger who looks very different from you and please don't come near me. Right? And it's sparking a much bigger national reflection on what kind of society people want to live in. And I think that's really what every society is going to have to do. Yeah, because I believe that this situation is just very clear in Singapore because the testing is happening and it's so transparent. But I would guess that every single country, every single city has a pocket like that, right? A marginalized community that is almost living in a different universe from the rest, and where the pandemic is spreading. It's just whether you want to look at it or not. And once you turn your attention to it, you cannot turn away anymore. Right? You will realize it's not just about disease, but so many different things are intertwined. Another example that gave me some hope too was reading about Chelsea in Massachusetts, which apparently is the city with the highest incidence of COVID-19 in the state. And it was because of a Boston University School of Public Health professor who looked at the data and saw, hey, wow, even though the raw numbers look low, the incidence of COVID-19 spreading in Chelsea was higher than in Manhattan. So she knew how to read the data. So she immediately got the governor involved, alerted all the people. She was on the board of a nonprofit that works in that area. So in this city, there are more than 40,000 people, many low-wage workers that are jammed into 1.8 square miles of industrial land. Many are immigrant families from El Salvador, Nicaragua, Guatemala, and Mexico who stay in very close proximity so that they can afford the rent. And that area has also been a dumping ground for the state. So there's been a long history of industrial pollution. So people who live there have a lot of chronic health problems. So she knew as an epidemiologist, this is a disaster waiting to happen, right? So it was amazing that she got all these people involved, got the city leaders involved. All these people came together to, even the National Guard, right, to give out food in Chelsea as well. So I think it's a good example of how in this crisis, we have to give support where it's needed most. That's where it has to start. And that's what equity is actually about. It's not giving the same thing to everyone. It's giving support where it is needed the most. Yeah. I'm also very glad to read that Massachusetts now has the first, I believe, statewide contact tracing initiative. And it comes from the state government, partnering up with Partners in Health, which is Dr. Paul Farmer's organization that has done a lot of contact tracing work in Africa and in South America. So they're taking that expertise and bringing it back here to the US, and they're trying to share that knowledge across different states as well. So it's a community collaboration, and people can sign up to become contact tracers and help the state in this way. Yeah, so I think really this is a time for partnerships of all kinds to solve very complex problems. But what a wonderful opportunity if we can use it wisely, right? That it doesn't stop with just this pandemic, but we say, hey, what is causing these problems? What are the deeper underlying conditions? Yeah, not to be palliative, but to look at the deeper roots of social problems and to see what we can do collectively. So in closing, I wanted to share a quote from Dr. Agnes Binagwaho, the former Minister of Health in Rwanda, about the whole COVID-19 situation. I have to say, I've been reading news about developing nations and how they deal with COVID-19 as a way to bring hope to my life. So sometimes reading the New York Times is like, so I'm like, okay, it's a very big world. Every country has a different approach. Every city has a different approach. Let's try and find examples of people working together to create goodness in the world. And there are many, many such examples. So Dr. Binagwaho says, the interviewer asked her, what is your guidance or encouragement to people working hard in the face of a pandemic to make sure that they keep equity uppermost in their response? And she says, repeat every day that the life which is in front of you has the same value as the next life that will be in front of you and the next life that will be in front of you. I think we need simple language like that. The world still has a long way to go, but I think we will make it. We will make it.
What there's been in America for centuries, actually, is this is other people's problems. And if I don't see it, it won't influence me. Mm-hmm. And so as a country, we just, because we have a lot of space, we just put these things off and then we don't have to look at them. And what I think this pandemic is making us realize is that what happens to the frontline people, what happens to the poor people and the people who don't have high status jobs actually affects all of us. And hopefully people will start to see that you can't just say, out of sight, out of mind, but that what happens to these people influences us. And then you come back to what Aristotle says, is if you want to be selfish, be wisely selfish and take care of others. Because these are the people who grow our food, who stock the stores, who, clean the offices. They aren't some other people that, the middle class doesn't have to pay attention to. Everybody's really joined together